Coming up next on KPBS Evening Edition, help could be on its way for struggling homeowners, but is it too little, too late?
And a San Diego researcher helped solve a medical mystery for this little boy and his family. KPBS Evening Edition starts now.
Hello, thanks for joining us. I'm Joanne Farian.
And I'm Dwayne Brown. College students walked out of class in San Diego and across the country today.
Whose university? Our university! Whose university? Our university! Thank you, everyone.
This rally at San Diego State University was part of a protest called the National Day of Action for Education. Students and professors were protesting ongoing cuts to public education.
And for so long, students haven't come together, and that's why for the last 14 years, as Chancellor Reed has been the chancellor of the CSU, it's gone up and up and up because this kind of thing isn't happening. So hopefully when we get together and make our collective voice heard, he won't keep imposing these tuition hikes on us.
Tuition has been increased for both CSU and UC students. Community college students are also paying higher fees.
Leaders of the San Diego Unified School District are calling on the teachers union to negotiate concessions to avoid layoffs. The district faces a budget shortfall that could hit $122 million in the next school year, and it has to send layoff notices by March 15th. The district's already made a deal for wage and benefit cuts with its Police Officers Association. Tomorrow on the roundtable, we'll be talking in depth about this issue. Some local lawmakers are asking the Navy to reconsider a fallen Marine for the Medal of Honor. Sergeant Rafael Peralta was nominated for the military's highest honor for covering a grenade with his body during a battle in Iraq, saving the lives of other Marines. But the military concluded he wasn't conscious when it happened and instead awarded him the Navy Cross. In a letter this week to the Secretary of the Navy, Congressman Duncan Hunter points out an inconsistency in that citation that went with the Navy Cross. He writes, the citation states, without hesitation and with complete disregard for his own personal safety, Sergeant Peralta reached out and pulled the grenade to his body. The letter was also signed by the rest of San Diego's congressional delegation.
Lots of San Diegans are getting on the Freedom Train to help injured military veterans avoid falling into homelessness. The Freedom Station provides transitional housing and recovery support to those who've served during the war on terrorism.
I got Marines and Navy living here, we're hoping to get some Army guys in.
Gunny Sergeant Juan Cano was the first person to call Freedom Station home last year. He served more than 20 years in the Marine Corps before settling in San Diego.
They're providing the care they would want someone to provide their family member, and that, that love comes over, to, us here at Freedom Station and Balboa Naval Hospital.
During deployments to Iraq, Gunny Cano survived multiple bombing attacks and was awarded a Purple Heart. He was treated for his injuries at Balboa Naval Hospital.
I come out and I got like 11 of my best friends that are my neighbors. And that's probably the best thing, about this place is that network of community.
This is basically what our warriors see when they first get here.
Sandy Lim Cooler has been a Navy wife for 31 years, and the Freedom Station was her idea.
You pull into a train station and you change the direction you're going in your life, and that's what we want for our warriors.
Lim Cooler also credits the generosity of volunteers and businesses who've donated furniture, appliances, time, and money.
It's a community effort. It's all about San Diego, and it's all about San Diego taking care of San Diego warriors.
There are 8 cottages and 4 apartments at Freedom Station, including wheelchair-accessible rooms for the disabled. Residents pay a portion of the rent and are encouraged to save the rest for permanent housing. Lim Cooler believes this is the missing link to keep young injured vets from homelessness. She's looking at another site like this to expand the program with help from the community. If you want to help the Freedom Station expand its service, text the words that you see on the screen, PRIDE, to 20222 to donate $5 to help injured service members in San Diego. A new report from RealtyTrack says foreclosures accounted for nearly half of all home sales in California between October and December. We wanted to get a close look at what it means to San Diego County. Here are some more numbers. State figures show 1 in 27 households in the county was foreclosed on between 2008 and 2010. And in the last quarter of 2011, more than 4,800 mortgages were in default. That means the owner is behind in payments. During the same time period, there were more than 2,000 foreclosures. This week, California's Attorney General introduced a series of bills to regulate the foreclosure process. Joanne has more on that at the roundtable.
The bills are designed to protect homeowners caught up in the mortgage and foreclosure crisis. Joining me to explain what the proposed legislation would do is Dr. Michael Lee, director of SDSU's Corky Macmillan Center for Real Estate. Dr. Lee, thank you for being here.
Thank you for inviting me.
Let's begin with some of the key points in these bills, because I read some of the bullet points, and I'll be upfront with you. Some of them seemed like obvious things that you would think were in place. Things regarding signatures and notice, but they're not, are they?
Well, they're not, because a lot of that had to do with what servicer practices have been. And servicer practices have been both all over the map. They're not in a standardized way. But secondly, servicers have been working on kind of an understaffed pressure situation that has led them to cut a lot of corners.
So what will this bill do? What would these bills do?
Well, one of the major objectives of these bills is to provide more of a certain standardized, transparent process. And it has requirements for the lenders to basically go through an offer and evaluate modification alternatives before instituting a foreclosure process, and it really requires or puts the onus on them to, have this done right, avoid some of the kind of outsourcing problems that plagued earlier processes.
So this is really about regulating the foreclosure process by government as opposed to just sort of it being self-regulated as it has been in the past. Now, one of the things these laws seem to look at is something called dual-track foreclosures. Now, we hear a lot of stories out there about people who say, well, the only way the bank would renegotiate my loan is if I was behind on my mortgage payment, so I decided to stop paying. Is this what dual-track foreclosures is trying to address?
Dual-track foreclosures relates to the fact that banks were both engaging in modification discussions and evaluations with borrowers and pursuing a foreclosure action at the same time. And in some cases, the foreclosure action gets ahead of the loan modification discussion, and all of a sudden the homeowner finds that their house is up for sale, and they say, but I've been talking to the bank about modification. Part of that is that two parts of the bank different parts are doing this, and they're not necessarily talking to each other. So at least this would put a more formal process. But I will want to correct one thing, is that the government isn't specifically regulating this. This is still up to the banks to come up with these practices that meet these guidelines. And the regulation, if you will, is the threat of potential legal action that could overturn a foreclosure.
Oh, okay. So let's pick up on that a little bit. So if these bills become law, this doesn't say, it's not the law of the land for banks. It just says you must follow these regulations or else.
Or else there is a task force that's being set up that could pursue legal action against the bank. There are civil penalties that the bank may have. There are also provisions within this in which the borrower can go to court and challenge an action, and this gives them more of a standing in the court.
So the bottom line, if these become law, what happens to our housing market in San Diego County? Does it get better?
Marginally, but this is not going to have a big effect on the housing market. And one reason is that the magnitude of the settlement, even though California got the lion's share of that, is still small relative to the total magnitude of the problem.
You're talking about the past settlement a couple weeks ago.
A couple of weeks ago. And a lot of what the Homeowners Bill of Rights is codifying the agreements that were put into the settlement. Remember, the settlement only covered 5 banks. Mm-hmm. And so this is being a more widespread, this is going to apply to all banks.
Finally, we don't have a lot of time left, but how are the banks reacting to this?
Well, I haven't seen specific comments from them, but I think that one reason that the banks entered into this agreement is to kind of remove some uncertainty about future litigation that can come from state, federal, or private sources. And the settlement goes part way, but not certainly all the way in there. If it did provide that certainty, that would be good for the banks because then that might get them to do more lending. The problem is that there's still a lot of uncertainties here, and the provisions of the settlement add significant costs and some potential risks to the banks. And so one negative of this may be that we don't really open up the lending spigot significantly, and I think that's been something holding back the housing market.
Okay, Dr. Lee, thank you so much for being here.
I appreciate it very much. Thank you, Joanne.
This Saturday is the day pop culture fans have been waiting for. Comic-Con International says badges for this year's event will go on sale Saturday morning at 8. You have to have a member ID to actually get a badge. That's part of a new system aimed at stopping scalpers. A piece of San Diego history is open for business once again. The Plunge at Mission Beach reopened this morning, 9 months after closing because of a dispute between the leaseholder and the city over renovations. Yesterday, the city signed off on repair work to the 87-year-old building that houses the saltwater pool. A spokesman for the Plunge says it's the first step in a long-term revitalization. He says attendance today was a bit light, but expects to see more business this weekend as they offer 25-cent admission for residents. A 10-year-old Pennsylvania boy has made a special trip to San Diego to say thank you. In a moment, we'll meet him and the San Diego researcher who found the cause of his life-threatening genetic disorder. This is KPBS Evening Edition.
It's your economy,
your health,
your environment,
your country.
And it's your choice for president.
Need to Know, covering the issues that matter to you most.
Watch Need to Know, Friday night at 8:30 on KPBS.
Because of our members, it's possible for everyone around us to discover something new every day, right here on KPBS. And in doing so, our members make this a better and stronger community. Thanks for your support.
Hello, I'm Peter Marshall.
And I'm Nick Clooney with another edition of My Music from the glorious Big Band era.
Night and day. Music is timeless. It's my music. The Big Band vocalist right here on PBS.
Saturday at 6 on KPBS. KPBS Evening Edition is made possible by Joan and Erwin Jacobs and by
There are about 7,000 people in the U.S. who have a rare disease. Most are genetic in origin, and about half of all rare diseases affect children. KPBS science and technology reporter Peggy Pico tells us about a boy who traveled from the East Coast to San Diego to thank the researcher who discovered the cause of his genetic disorder.
Mason Bartow's dad recorded this video the morning his wife told their son, a San Diego researcher, found the cause of his rare and life-threatening genetic disorder.
There's all these genes, and they knew that there was one in your body that was causing all these problems, but they couldn't find it. They found it.
You can see when 10-year-old Mason realizes the implications for him and others who have congenital disorders of glycosylation, or CDG.
This doesn't mean there's going to be a fix. It means probably that there's going to be days that you might not have to have your tube hooked to you all the time. And it means that when other kids get sick like this, they won't have to look so much. They'll know right where to go because of you.
A few months later, Mason and his family traveled from their home in Pennsylvania to the Sanford Burnham Medical Research Institute in La Jolla to meet the doctor who discovered the gene responsible for his severe medical problems.
And we have a picture of the whole lab wearing our Mason's Hope t-shirts.
He said he'd want to come and meet Dr. Freeze and shake his hand, and so that's why we're here.
So discovering Mason's gene sets you up to then go back to the basic science and say, here's something we never even thought about before. We have no idea how this works.
Freeze hopes the gene discovery will lead to new treatments. In the meantime, Mason and his family joined others for a tour of the lab and a chance to talk directly with researchers from around the country.
Rare diseases really provides Rosetta Stones for understanding much more about physiology, much more about common disorders.
CDG is far from common. Mason was 2 years old when he was finally diagnosed, even though he nearly died the night he was born.
He was born with a cleft palate and a small jaw, and we actually didn't know that he had as many severe problems as he had until the first night of his birth, when he quit breathing.
This helps me breathe.
And CDG makes it impossible for Mason to maintain life-sustaining blood sugar levels. So 5 times a day, he ingests a special sugar cocktail through a tube in his stomach to keep his blood sugars high enough to sustain organ function.
I ate no blood sugar, and I can't do that. Like, I can't run for a long time like other people.
Still, he's able to play ball with his 14-year-old brother. He attends school daily and gets good grades.
He's proved from day one that he's going to beat this, so he makes it very easy to go on.
Eric Green, director of the National Human Genome Research Institute, says Mason's new genetically based treatment and response will become part of a genetic database for the National Institutes of Health.
We have now set up in the past just couple of months several specialized centers who will take in samples from really around the world of individuals with very rare genetic diseases and use state-of-the-art genome sequencing technologies and analysis methods. We believe we can industrialize the elucidation of the genetic cause of these rare disorders.
Meanwhile, Mason is soaking up all that Southern California has to offer.
We went to Legoland, Disneyland, the zoo, and SeaWorld.
All the while living by his best friend's motto, take a chance.
I have a dog.
You have a dog? What's your dog's name?
Chance. He's my best friend.
That was KPBS Science and Technology reporter Peggy Pico of the Sanford Burnham Institute team with the NIH to raise awareness of this rare disease earlier this week. We have more on a report card we told you about earlier this week. It looks at how San Diego families and children are faring. Joanne has more at the roundtable.
There was both good and bad news in the report by the Children's Initiative, a group led by my next guest, Sandra McBrayer. Thank you for being here.
Thank you. It's my pleasure.
I want to talk, first of all, about this report card. It comes out every 2 years. What is it your group aims to do with this?
It really is to tell both policy leaders, elected officials, community, what's happening with our children and families, and where do we need to focus our efforts. So to really fine-tune where our limited resources can go to make the biggest difference.
So let's start with the good news. Where did you see improvement overall?
There was some exciting news, because you would think in this economic time there wouldn't be some great things happening, but there are. We have less teens having babies than ever before. In fact, a 33% decrease over the last 10 years. We're seeing more kids becoming more fit and eating healthy, so our obesity rates are dropping. School achievement is up. In fact, we surpass California in our school achievement. And we have declining crime for our juveniles. They're safer than they were ever before.
I want to talk about obesity rates, because this is something that we've been talking about in our community for years now. We see averages across the country going up. What is San Diego County doing to get this rate down?
Well, they did more than talk, and that's what's exciting. There are so many school districts who really stepped up and said, what else can we do? Chula Vista Elementary School District's a great example. They actually partnered with the health department to do body mass index for kids, to be able to say, who should we target? What's interesting is they took that data even further. They looked at zip codes and residents, and then they overlaid it with fast food restaurants and with Parks and Rec. So they could actually say, in this region, we have more fast food restaurants and a higher percentage of obesity. How do we educate those parents about healthy choices and healthy meals? How do we advocate to our city council about more Parks and Rec when we uncover some areas with none? So really using data to say, how do we tackle this problem?
Now, in terms of the next bit of good news with the lower pregnancy rate, down 33%, I think the number was.
Yes.
Why? What's happening there?
There's more programs in San Diego. We partner with the San Diego Adolescent Pregnancy Project, who had historically worked in San Diego Unified, and they actually got funding from First Five, and we're able to go to a broader audience in San Diego to get young girls on the right track. What's interesting with SANDAP is nationally, if a young person has a baby, their rate of having a second child as a teen is 20%. SANDAP's percent is 1.8%. Because they do intensive case management. They see those young girls every day. They get them re-enrolled in school. They're really saying education is a success. So they really change the kind of community norm for many young women.
Let's go to some of the bad news, the areas of improvement. What were the areas that stood out for you in this report?
You know, we expected poverty, and poverty was an area of improvement in our county, but it allows us to look at zip codes to say if we have limited service, where do we need to add more GED classes for adults? Where do we need to add more job training? But also immunization is of great concern. We, for the first time, fell below the national objective. So we went from well over 85% to 76%. And so that's something that we really have to begin and continue a broad scope campaign to teach people about the safety of immunizations.
That seems shocking to me. I'll be honest with you, when I read that statistic, this sort of dramatic drop, why do you think that fewer kids are being immunized?
There's a couple reasons. One is we've, as school districts have told us, we have more waivers for parents opting out of immunizations. And so that's a campaign of education. That's a campaign. There were many reports years ago that have now proved false that said immunizations was tied to certain diseases. Internationally and nationally, it's proven not to be true. We've got to get that information everywhere. The other issue is we have to make sure vaccines are widely available. As you know, a couple years ago, there was a production issue. So that impacts our numbers when we actually can't access the vaccine for families. The other important thing is that for many poor families, a lot of times vaccines happen when you bring your child for a well baby check. But in poor families, they don't always have the well baby check. So we need to educate physicians that even if the child's mildly ill, you still need to talk to the parents about vaccination.
I know we've talked about this before, and you bring up the data. Now, your organization really has this incredible amount of data where you can go into neighborhood by neighborhood and know what's going on. What do you do with all of that? You have this report, but what else can you do with this data now going forward?
We actually go to every community group you can imagine. It's sent to every elected officials. We go to city councils. We go to task forces and committees, and then we tailor it for that community. So when we're talking in National City, we tell National City, what are your top 3 indicators you need to focus on so that you're spending your time at the greatest need, not necessarily on what someone happened to mention to you. It's really getting it out there to the community.
Our time is up, but I want to let the people at home know they can access your report through our website, kpbs.org. Sandra McBrayer, thank you so much for being here.
Oh, it was my pleasure. Thank you.
The Auto Club is offering a new device to help parents keep tabs on their teenage drivers. The AAA onboard device gets plugged into the car, then transmits information about the car's location. Parents can also set a maximum speed, geographic boundaries, even a curfew. When those rules are broken, parents get an email or a text message. There is a catch, though. The Auto Club is only offering this to families with AAA insurance. This is KPBS Evening Edition.
I'm Judy Woodruff. On the next News Hour, the Daily Download, our regular look at how the political campaigns are using social media this election year. That's Thursday on the PBS News Hour.
Go further. Fly higher. Get closer to nature. Winner of the prestigious Grand Teton Award. Nature, Wednesday nights. From the most remote corner of the world to your own backyard. Nature, Wednesdays at 8, only on PBS.
The American people have named PBS the most trusted source of news and public affairs
for the 8th year in a row.
Trust.
The American people have spoken.
Thank you.
Welcome back to the Public Square on KPBS Evening Edition. Tonight we wanted to follow up on our story about the cost of public pensions. Earlier this week, I asked Lonnie Lutar, head of the San Diego County Taxpayers Association, why the pension debate has been framed to assume public sector employees shouldn't have better pensions than the private sector. Here's what she said.
Well, I think what we used to see in the public sector was that there were greater benefits provided because the base pay was significantly less than the private sector. But what we have now observed is that there has been a significant shift, and in many cases for employee categories, public sector employees are receiving more in not only their base pay or salary, but they're receiving more in their salary and their benefits.
Lutar provided us with a study from the Bureau of Labor Statistics, and she's right. Private sector employees cost, with wages and benefits, just over $30 an hour. Public sector employees, on the other hand, cost a total of nearly $41 an hour. However, that same report says this: compensation cost levels in state and local government should not be directly compared with levels in private industry. Differences between these sectors stem from factors such as variation in work activities and occupational structures. Manufacturing and sales, for example, make up a large part of private industry work activities, but are rare in state and local government. Professional and administrative support occupations, including teachers, account for 2/3 of the state and local government workforce, compared with 1/2 of private industry. Well, you can weigh in on this conversation by following us on Twitter. You can always like us on Facebook. And, of course, you can email me, jfarian@kpbs.org. And now let's go back to the news desk where Dwayne has a recap of tonight's top stories.
Today, students at San Diego State University joined their peers across the country in a National Day of Action for Education. It was a protest against school budget cuts. Leaders of San Diego Unified School District are asking the teachers union to negotiate concessions to avoid layoffs. The district is facing a possible deficit of $122 million next year. And San Diego's congressional delegation has sent a letter to the Navy Secretary asking him to reconsider a fallen Marine for the Medal of Honor. Sergeant Rafael Peralta died in 2004 after covering a grenade with his body. He was awarded the Navy Cross. You can watch and comment on any of the stories you saw tonight on our website, kpbs.org/evening edition. Thanks for joining us. You have a great evening. We leave you with a look at the forecast.